Everyone, to our next COVID conversation. I would ask all of you who are not presenting today to make sure and mute yourselves. And I'm very thrilled to welcome to COVID conversation number 7, the pandemic and urban parks. I'm welcoming Kyle DeHart, risk specialist for Portland Parks and Rec. And I think I said your last name correctly, Kyle. Kyle, I'm first, before I fully introduce you and have you join us, I did want to remind everybody that we have 3 remaining COVID conversations, as we did decide we're going to take this through June with our 2nd and 4th Tuesdays. Our next event is May 25th. And that's number 8, public facing workplaces. What about restaurants? And we're very fortunate to have Lisa Kinsley, who works in human resources for McMinimums, join us that day. And that will be hosted by Nicole Guilfoy. So that is terrific. And I did put a link in the chat where you can access all of the remaining COVID conversation registration links, as well as our symposium on climate change, which is next week. So if you're not familiar with that, please check the link out. And if it works for you, it's Friday, the 21st, May 21st, which I can't believe is already next week. So on that note, welcome, Kyle. And can you give us just a little bit of a background about what your job entails?
Sure. Thank you, Dee Dee, and thank you everyone for being here this morning. It's great to see you all and some familiar faces. So as Dee Dee noted, my name is Kyle DeHart. I'm with Portland Parks and Recreation, where I serve as one of their risk specialists. I've been with the city since June of 2018, and in non-COVID times, and even now, my job responsibilities generally involve matters of environmental health, so managing the Bureau's asbestos, lead-based paint, hazardous waste, indoor air quality programs, traditional industrial hygiene type matters. And then I also serve as Parks' Department of Environmental Quality liaison, so working with them on intersectional matters with our properties. Since March of 2020, I've had the, pleasure of serving as Parks' COVID safety officer, one of them. And so I've been involved in case response, doing public health guidance interpretation, control measure implementation, and developing COVID operations and safety plans for all of our numerous assets. And then lastly, outside of work, but, related to this, I am currently a student at Montana Technological University in their industrial hygiene distance learning program, where I am pursuing my MS in industrial hygiene and hope to wrap up this August.
And congratulations on that, Kyle. That's a really big deal. And I've been impressed with that program. And it's a great shout out to Montana Tech for their online industrial hygiene program and their face-to-face program. So thanks for sharing that. Kyle, I've been able to hear you speak a little bit about work in parks through some of the planning for next fall's Northwest Occupational Health Conference. And I just think it's interesting to step back and think about how jobs have changed a lot in the last, decade, certainly, and particularly recently. So I guess my kind of first question is, what have been and certainly continue to be the biggest challenges for all of you pertaining to COVID-19?
Yeah, thank you, Dee Dee. So our challenges probably aren't too dissimilar from most organizations, but I think what can separate us a little bit is that, we have an occupational health and safety lens where we need to ensure the safety of our staff from this new pathogen in the community. But then we also are a very community-facing organization where, we need to make sure that we're also taking care of community members and making sure that, for the programs that we still are offering, that we can keep them safe and healthy and, meet public health guidance. So we've had a lot of challenges. I think through
Megan,
this
are you here?
pandemic, we've
I'm gonna
seen
go.
that parks are integral to, during a pandemic. So early on, one of the things that we were asked to do was to stand up 24/7 hygienic services for our community members. And so normally, we have restrooms in all of our parks that are, open during, daylight hours. But we wanted to make sure that members of the houseless community and others would be able to wash their hands and practice these important hygienic measures at all hours. And so that was a tall order for us to stand up porta johns at 54 different locations offering 24/7 service, and then making sure that they weren't vandalized or anything like that. So that was new, and we rose to that challenge. But then also, one of the other unique things is, we were asked to turn our community centers into shelters for the community. And while we do have some experience with that, during heat wave events or winter weather events, doing so for such a prolonged period of time while in the middle of a pandemic, was certainly a challenge. But we recognize that parks could serve the community in this unique way and rise to that occasion. So those were some, but I think a past challenge and a current challenge right now that a lot of you have probably experienced involves supply chain logistics. So early on in the pandemic, we all remember those early days when you couldn't even find toilet paper. Finding N95 masks and disinfectant and gloves. It was challenging, and it was new to us to be operating in this environment where we couldn't immediately get our hands on the equipment we needed to just do normal day-to-day stuff. And so trying to, build out a more robust, logistics operation where we can get accurate equipment counts and tabulate burn rates, determine our inventory and what goes in and what goes out. That was a challenge for us. It's not as much now. Masks are plentiful, disinfectants plentiful, but now we're, looking at issues, knock-on issues where, lumber prices have increased and things like that. And just getting, basic raw materials is challenging. We, a past challenge, but a current challenge too, is dealing with conflicting public health guidance. So as parks providers, we recognize that we're not experts in the field of public health, and we really want to make sure that we defer to the best scientific guidance that's out there. And that's been how we've approached this from day one, is relying on the Oregon Health Authority, Multnomah County Health, Oregon OSHA, to guide all of our decisions. But at times, what we're finding, and this was early on, but now, is that sometimes there can be some conflicts. Recently, I'm sure you're all aware, the CDC made announcements regarding mask usage in outdoor environments for those who are fully vaccinated, which is awesome. It indicates we're moving in a positive direction. It took a little bit longer for the Oregon Health Authority to move forward in that direction, and they have. But now we're under the new Oregon OSHA permanent standard, which doesn't necessarily have any mention of vaccines other than in 2 footnotes in the permanent standard. And so, we're trying to operate within all of the existing regulations, and sometimes they don't update with one another concurrently. And that's been a challenge to both explain to our staff, why we're still requiring masks for fully vaccinated people, but then also explaining to community members that are showing up for, outdoor fitness in the park type events, that despite this guidance from the CDC and the Oregon Health Authority, there's still other regulations that we need to follow. And so, that's been really challenging for us is, trying to move what can seem like a giant ship really quickly in response to these changes where, one day we're in extreme risk and the next we're in high risk.
Thank you for sharing that last point, especially, I think we've all felt that. We've had these reputations as being, folks that give out, the science or what we know, and when it shifts back and forth, we worry about that. In fact, this morning I read, and this is going to come back, right, where there was a news article saying 10%, less than 10% of the cases that have been tracked have been outdoor. And I don't know if any of you saw that article this morning that says, well, that was a way overstatement. It's closer to less than 1%. So I'm sure that's going to be interesting. I'd actually want to ask a very specific question.
Sure.
I know in my community, playgrounds were this, got to be this incredibly controversial community conversation, right? And I know that in my community, the staff would rope them off or tape them off, and then there'd be reports that the tape was gone. And I'm just kind of curious if you have anything beyond maybe the obvious to share about that work that you needed to do around playgrounds.
Yeah, thanks for bringing that up, Dee Dee. Yeah, that was definitely a challenge in the early days. I think we all remember the time when there was still so much confusion that we thought that touching any surface, would be a primary means of contracting the virus or transmitting it. We now know that the chances of that are very low. It's generally aerosolized, and short distance transmission pathways. But when we were, operating under that fear, regarding fomite transmission, we also took the means to, take caution tape some of our playgrounds and things like that. But it was really quickly realized that it wouldn't really be an effective means to prevent the community from using playgrounds. We have, I think, over 150 parks, and I can't even tell you how many different pieces of playground equipment we have. And so it became extremely resource intensive, one, to, caution tape everything. And so quickly it translated more to a hazard communication standpoint, where we wanted to make sure that we put signage out in all of our parks and natural areas, letting people know, well, this was actually back before masks, I think, but, physically distance, wash your hands, hand sanitize after, using playground equipment. Yeah, I'm glad that that didn't last that long, because just staying on top of that alone would have just taken so much energy from our organization.
Yeah, thank you for giving us some specifics on that. Well, so this is the time I'm going to ask. We have about 5 more minutes. This always goes quickly. And for those of you new to this, what our kind of plan generally is to do about 20 minutes of discussion, and then we reserve the last 10 minutes for questions. And so if you have questions, feel free to put those in the chat, and Nicole will very kindly share those when we get to that part of the program. But before we do, Kyle, I do want to know, lessons learned, right? I feel silly asking, are there things you wish you knew before? But that being said, are there some things that you've ever thought about, and especially things that might change practices from here on out? That's kind of the second part of that question. So whatever your thoughts are.
Yeah, I think one of the things that has really stuck with me, and I think our organization, is we want to make sure we trust the science and we trust the experts. Recognizing where our limits are, and making sure that when we need to make tough decisions, particularly that relate to matters of public health, that we're gathering all of the information necessary from trusted sources to make those calls. I think another lesson learned is that being unified is extremely valuable. And so there have been multiple times where we have worked with the Oregon Recreation or Parks and Recreation Agency or Recreation and Park Agency, but essentially it's a like a trade group and industry group of the different parks and recreation agencies in Oregon to understand what they're doing, or what's going on in Hillsborough, what's going on in Tualatin Hills, because at a certain point, even though we're Portland, city of Portland, we're still kind of a metro region, and if we're doing something entirely different from Hillsborough or Tualatin, or we want to make sure of that. And so having those conversations, but then also being unified, so that when we need to bring a matter of concern up to the Oregon Health Authority, we can do so essentially as a team. And so that's been valuable. Similarly, in that vein, I know early on in the pandemic, I had reached out to some colleagues at San Francisco parks as well as Seattle parks, asking them, hey, what are you guys doing about this? Do you have any insights here? So just trying to, really understand both what's going on in the public health field, but also then how that translates into parks and recreation action. So that's been valuable. And then lastly, I guess I'll just add that, as I noted, one of the challenges was supply chain logistics. I think that's a significant challenge for a lot of organizations. I think it still can be for ours. Getting an accurate understanding at all times of what we have in stores, and burn rates, and what needs used where. That's something that I think can still require some improvement, and would see benefits not just during a pandemic, but even just during normal operations.
Thank you. I've jotted those down. Those are great pieces of advice moving forward. And I particularly like the one about, connecting with your colleagues, right? And whether it be parks from that unification approach, but it's also, I think, it's something I think many of us remind those who are newer to our field, which is, think of all the times you've reached out to your colleagues about things that you just are looking for some support or some assistance on, so we're all moving in a similar direction. So I think that's really kind of priceless. Before we get to one of the questions, I'm going to ask a question. Sorry, Nicole, I'm going to interject. I would love to know your thoughts around employing your young workers this summer. We had a little chat about this before we started the recording, and I know many of the folks on this call are really interested in those things that do support our younger workforce. So, and we know Parks generally employs quite a few. So any thoughts on that?
We do, yeah. The first thought, and the most important one, is that just like our full-time regular staff, we need to make sure, and we are, that we're offering a safe and healthy environment for our young workers. And I think right now it's a challenge for a lot of organizations, finding staff. And I think that can be particularly so for younger individuals who, are probably, their parents or guardians might still be a little fearful about having, them work in the middle of a pandemic. And so, one of the things that we're doing is, in our marketing materials and outreach to, to those interested, we're letting them know, here are the control measures, here are the safety measures that we are implementing as an organization to ensure that while you're in our employ, we're doing everything we can to keep you safe, from this pathogen. Everything from masks, physical distancing, occupancy limits in buildings, and none of that is going away. And so outlining clear expectations. But also just sharing with them, what we're doing. So we are hiring. We're hoping to offer. We're looking to offer a number of different summer outdoor programs this summer. We're really excited to have people come back and recreate with us. I think it's really important. It's been a long year, and we need to move our bodies. Yeah, for anyone that is interested in working for a Parks and Recreation agency, reach out.
Thank you. That's great information, and I appreciate that. Okay, Nicole, you have a question for us.
I do. Well, Kyle, I just want to give a little plug for seasonal workers at parks in the summer. When I was a young worker myself, I had the opportunity to run a little program out of East Portland Community Center. And I have to say, working for parks provides amazing experience that I think is quite transferable to other fields. So I do have a question here from Kate. Many of the mitigation practices that we have developed for COVID also apply to other respiratory diseases, such as the flu. Has this experience changed any of your practices that you expect might carry over to flu season?
Thank you. Yeah, that's really great. I actually had that as another bullet point under my lessons learned. So, I think time will tell. To what level or degree we will be able to continually implement certain practices that have arisen during COVID. But one thing has been made clear that implementation of these practices has resulted in a drastic reduction in influenza cases and just general cases of illness. Certainly, we can't have individuals from home forever. I mean, I think there's going to be some changes regarding telework, but at some point the city will be, bringing people back, we hope. I think we have learned that someone is sick or ill, the importance of, we always harped upon it before, but, we see it works now. If you stay home, you keep distance from others, you wash your hands more frequently. And so, I can't say with confidence that these practices will continue after the pandemic, but I really hope that, we institute some changes along those lines to, further keep illness out of the workplace, not just COVID, but, the common cold and influenza. It would definitely go a long way towards helping promote total worker health.
That's great. Kyle, one last question for you. Speaking of total worker health, one thing that's unique about Portland Parks and Recreation is that your facilities really do reach into the far corners of our city, and you are very broadly distributed around town. Have you seen any change, any shifts, any new initiatives in terms and opportunities in terms of collaborating with other central service agencies such as HR or safety and health or facilities? To be able to integrate and move toward a model of total worker health?
Yeah, that's a really good question. We just how we've collaborated with our external partners. I think we've seen during the pandemic that collaboration with our internal partners, be they the other bureaus, city risk management, that they've been bolstered. That we've realized that in solving some of these significant issues, COVID, that the city needs to be unified. We can't just be siloed into different bureaus all the time. How that translates to total worker health or future initiatives, I think that remains to be seen. Right now, we are still really just focused on getting past this pandemic and, making the changes that need to happen to get our community centers back open. But I hope that, once we're in a better place, a more normal operating environment, that, we do take some of those practices, learned during this, and then translate them into just normal implementation of initiatives that would be within the realm of total worker health.
I'm going to jump in. I really appreciate what you're saying, and I appreciate that question. And it has me thinking, several of our previous speakers have shared the same thing. I know Dave McNeil talked about, connecting with different parts of his organization in a way he hadn't before, they hadn't before. And I think maybe there's a place for a follow-up kind of WebEx type web workshop for all of us. Liz Hill's maybe taking notes there, so that we could really trade what we have learned in this and thinking about how it can grow and help us be more effective in managing, you know, and working, not just, I mean, the total worker health piece, but just traditional safety and health move together with wellness and well-being. So thank you for sharing those thoughts.
Yeah.
Nicole, any other questions? And maybe what we just do is I did see, oh, there you go. There's another one.
Oh, wonderful. This is an important question. You know, business continuity training and transition planning is not something that many organizations have focused on, but COVID has certainly brought the need for such planning right to the forefront. Do you see any of those lessons from COVID in terms of improving business continuity planning, kind of applying over to disaster planning and other issues?
Oh yeah, yeah. So our COOP plans, when the pandemic started, I think there was like maybe a paragraph that was, you know, they would potentially, our sites would be used for vaccination clinics. You know, our COOP plans have generally been written for a disastrous earthquake, because that's what we were expecting. And so, you know, I think one, we definitely realize that there is more that parks and recreation agencies can do during a pandemic, and that should be reflected in updated COOP plans. But then also, you know, operating within an incident command structure was new for a lot of us. You know, we've done drills or maybe small scale events, you know, a snow and ice storm for a day, but being within an incident command structure for weeks and months, you know, it was new to us. And I think it's something that organizations do need to continually train and practice on, because, you know, while these events don't happen often, and we hope they don't, they inevitably will arise. And, you know, those who are on the incident command team need to know, you know, what it is their responsibilities are, and how to respond, how to do handoff. And so, you know, there is definitely a lot of room there for, you know, improving our response next time. Hopefully there's not a next pandemic, but, you know, we've definitely learned a lot from this one.
Kyle, thank you so much for your insights. This has been extremely valuable. One very last question. I know that there's a program through CDC about how to sort of push out supplies or vaccinations or medications in the event of an emergency. And CDC really likes it when large employer groups get together to organize that, and they've provided some structure for that. These points of distribution or pod drills have been popular around the country. Is this something that Parks is also participating in for their employees?
Yeah, so before the pandemic, so I know Joel Michaels, our city occupational health nurse, had had a COVID conversation with you all a few weeks back, and before the pandemic, we as a city had started, you know, practicing some pod operations, doing some drills and run-throughs. You know, so plans like that do exist within the city. You know, Parks doesn't have specific pods. You know, so in terms of future vaccination distribution and things like that for other similar events, you know, I think generally it will emanate from the city as a whole, from the Emergency Coordination Center, you know, as well as the Portland Fire Bureau. So, you know, a shout out to Portland Fire and that's there. They've been, you know, holding a vaccination clinic now for the past few weeks. And so, you know, the city has shown that they can stand up, you know, vaccination clinics, and they can do a good job of getting them out into the community and getting them out into particularly, you know, underserved populations and, you know, making that a priority.
Kyle, it's a great example. Thanks for sharing of other opportunities for interagency sort of collaborations within a large organization. We really appreciate you visiting with us today.
Yes, we're going to go ahead and say goodbye to everyone. And but first, Kyle, thank you so much for giving your time and expertise today. Thank you all for joining us. I'm going to go ahead and stop the recording. And